You can't wait to sit down, and just take the pressure off your back.
It's right there. It's like the small on your back. That's where it always hurts.
Let's go!
But you can only do so much. You forget sometimes how to bend. You just normally go to bend down, and then I forget, and then I feel it, and then I remember, unfortunately.
For Mimi Andreessen, living with back pain has become a way of life. With 3 children and a house to run, she can't stop.
I don't bend anymore. I kneel. Watch, my back's going to get better. My knees will go out.
Mimi's children have learned it's their job to help Mommy out. Little Max even gets himself into his car seat.
It's unfortunate because he knows, and he's always warning me to be careful of my back. I'll drop him off at preschool, and he'll say, "Be careful, Mommy, don't fall down." I can't pick you up more than once. Ugh.
Mimi's situation is not uncommon. She's become part of a statistic, a large one. A full 80% of adults suffer from back pain at some point in their lives. But lower back pain, the most common kind, does not discriminate. It hits moms like Mimi and big, strong athletes like Troy Aikman and Larry Bird, and almost everyone in between. Studies say back pain is the second largest cause of work loss behind the common cold. In any one year, 50% of all working adults have lower back pain. And that back pain is the most common cause of disability for people under the age of 45. The good news is, for 9 out of 10 sufferers, the problem will go away within a month. But for people like Mimi, whose pain doesn't go away, the next step is a trip to the family doctor, who can try to diagnose the problem.
Well, first of all, I ask them how long they've been experiencing the back pain, under what conditions they're experiencing it. Have they experienced any trauma? Have they had any changes in their lifestyle?
Give you a little leg lift here.
Dr. Migliori says doctors should do some basic in-office tests to find out whether your pain radiates up or down the back or into your limbs, which could signal a disc problem, a problem most back pain sufferers don't have.
About 15% of all back pain is actually a structural problem, such as a tumor, arthritis, herniated discs. Most back pain is really musculoskeletal. Usually it's a muscle strain from overuse or misuse.
Overuse from everyday living, like lifting kids.
You're going to make this hard on me, aren't you?
Or lifting on the job. And the pain it causes in your back can radiate into other parts of your life.
And if somebody is struggling with severe back pain and they're not able to do what they used to do, they can't do their occupation that they used to perform functions in, their daily life is affected and they become depressed because of that.
But it doesn't have to work this way. There are treatment options for people like Mimi and the millions of others who suffer from lower back pain. You don't have to take back pain lying down.
You can't wait to sit down, and just take the pressure off your back.
It's right there. It's like the small on your back. That's where it always hurts.
Let's go!
Again, it's bulging that hadn't broken loose.
The spine, a column of 24 bony vertebrae stacked one on top of another. Is it any wonder 8 out of 10 people complain of back trouble? The top area is the cervical region, where Coach Lou Holtz had his surgery. The middle, the thoracic. And the bottom and most vulnerable, the lumbar region, where I had my surgery. Between each vertebra is a cushion known as a disc, which can rupture, causing excruciating pain.
One of the exercises is bringing your knees to your chest.
But the immediate answer doesn't have to be surgery. There are options, like physical therapy.
By doing these, you can prevent back pain.
Correct. Yeah,
which is the key.
Correct.
It doesn't hurt.
The key to helping people understand their condition.
My analogy with this is we brush our teeth to prevent cavities. I don't know why we don't do some type of exercise regime, even if it's just a few exercises, to prevent the back problem.
And at McDonald Physical Therapy, they've found that this type of prevention really does help.
I think therapy, in many cases, at least 90%, I think the statistics show, therapy could help.
I went through about 5 weeks of physical therapy before finally needing surgery, but even my physical therapist and surgeon would agree not to use me as a barometer for its success. I had a severely herniated disc, which most people don't, and therefore can be fixed without going under the knife.
Neurosurgeon Dr. Robert Yount performs back surgery often, but says surgery is not the answer for most back pain.
Well, a very small percent, probably less than 1% of those people actually end up requiring surgery. For the most part, I tell patients that if they have back pain or neck pain, then surgery is not going to make that better, and that is largely true. We primarily do back and neck surgery because of leg or arm pain, not because of back or neck pain.
And that's why Mimi Andreessen is trying to solve her back problems through physical therapy.
I have a real good friend who's a doctor who had back surgery himself. And I'll never forget this piece of advice he told me. He said, I'll know I'll be ready when back surgery is when I'm begging for it, because that's how he knew it. I'm not begging for it yet. I haven't gotten to that point yet.
And doctors advise, physical therapy or no, it's important to stay active.
It used to be that when someone had a back problem, we put them to bed rest for a week, and studies have actually shown that that makes the problem actually worse.
Yeah, same spot.
And it's important to note that different types of back pain require different treatment and that no one way is right or wrong.
So it's not in essence saying, well, you don't have pain, so you go see our psychologist, and you have pain, so you go see our surgeon. That's not it at all. We're saying the people, come in, they're suffering with pain.
Pain that you may not be able to cure, but pain you might learn to live with.
You can't wait to sit down, and just take the pressure off your back.
It's right there. It's like the small of your back. That's where it always hurts.
Let's go!
Sometimes I'll ask somebody to help me. Like I said, I hate having to ask all the time for help.
No one likes the thought of living with back pain, but there are some things you can do to make the process a bit easier. The first bit of advice is to be good to your back.
When you have a heart attack, it's years of eating the wrong things, of your liver overproducing cholesterol, of arteriosclerosis, And we say, oh, well, obviously one incident didn't create that heart attack. Yet with our spine, for some reason, we think when we bent over to pick up that piece of paper and our back goes out, that was it. And I wish we could start thinking more in terms of, no, it's years of neglect.
And a man who has to fix those backs that we neglect has some important back-saving advice.
Stay in shape and don't gain weight. We certainly know that patients who gain weight have more back problems.
Let's do it!
And the way we live causes back problems. So here are some activities to avoid. Heavy lifting. Don't lift when twisting, bending forward, and reaching. Don't sit for long periods of time. If you must lift, then learn to do it properly, as I had to after my surgery. And all the experts agree, daily floor exercises, like you're about to see, can save your back and reduce your pain. The torso. Lying on your back with knees bent and arms on chest, lift your head and shoulders off the floor and hold briefly. The bridge. Again, lying on your back with knees bent and your arms at your side, lift your abdomen and behind off the ground and hold. The press-up is done on your stomach. Push yourself up on your elbows, arching your back. This pushes the disc away from the nerves. And the reverse curve. If you sit a lot, do several times a day. Standing with your feet slightly apart and hands behind your back, arch backward.
And if you have small children, the car seat can be one of the biggest culprits. After my surgery, I had to learn how to use my legs and my arms to lift the baby into the seat. What you don't want to do is put the strain on the back. And if you can, use your car or van for support.
Make sure your chair has good back support. If you sit a lot, make sure to get up and walk around occasionally. If you drive for a living, take breaks. Use a lumbar support or rolled towel in the small of your back. While sleeping, lie either on your back with a pillow under your knees or on your side with your knees bent and a pillow between them. And make sure to take your pain seriously. It's time to start thinking about going to a doctor if your symptoms are severe. The pain is keeping you from doing the things you do every day. And the problem does not go away within a few days. And seeing a doctor is a must if you have problems controlling your bladder, you feel numbness in the groin or rectal area, you have leg or arm weakness. And remember, only you know how you feel. Don't be afraid to let your family or your boss know what you're going through. The most important goal for you is to live pain-free.
I'm set. I'm done. Yes. Okay. I feel good.
things. I told my kids they didn't need to get me an electric toothbrush. And when I get a glass of milk, it's automatically better because it's a milkshake.
John Smith has been living with Parkinson's disease for 13 years, and keeping his sense of humor is one way he deals with the terrible tremors that have taken over his daily life.
There.
John is an artist, his home a tribute to his passion, filled with his paintings and stained glass. But it's a passion this former art teacher had to give up.
I've just had to put it aside. I can't do it.
And that's why John has decided to undergo a delicate surgery called deep brain stimulation. Dr. Robert Yount is a South Bend neurosurgeon who will be performing the first of 2 surgeries John will need. Today's surgery will last 4 to 6 hours.
And we're targeting an area called the subthalamic nucleus. And we've learned that if you stimulate the subthalamic nucleus, which actually inhibits the activity of that nucleus, that controls many of the symptoms of Parkinson's disease.
Before surgery begins, Dr. Yount talks to John about the procedure.
Slide back just a little bit.
The first step, Dr. Yount gets John ready for a CAT scan.
Now we're going to put the numbing medicine in. This part stings and burns a little bit, okay? This device here that we're putting on is called the bird cage. We just have this on when we get the CT because the CT scan sees these carbon fiber rods, and we use that for our localization.
Once the helmet is in place, John is wheeled away for his scan.
Okay, you doing all right there? Okay, no pain or anything? Okay, just try to relax, take some deep breaths.
After taking the CT, Dr. Yount looks at the images of John's brain.
So this is half MR and half CT, and then I can slide back and forth. And see, I'm checking to make sure everything matches well. This is an excellent merge.
Which means John's surgery is a go.
We got excellent images.
Great.
We've identified our targets. I was able to actually see the subthalamic nucleus.
Really?
Yeah, so I think we're going to do pretty well here.
Just minutes until surgery, John tries to keep the mood light with his daughters.
I guess I'm going to get my hair cut later.
But it's time to go for what everyone is hoping will be a life-altering surgery.
Kisses, high fives before we scoot on out of here.
While John and his family are praying the surgery will give him his life back, there is also the risk the surgery could take it away. "8:30 a.m., time to get John into surgery.
Yeah, we decided to do that to take your appendix out, right?
Okay, good.
Some pre-surgery humor from Dr. Yount, but everyone knows what happens in this operating room in the next few hours could give John his life back. Remember, John must stay awake during his brain surgery to help Dr. Yount test the stimulator. The first order of business, a haircut.
You're getting the most expensive haircut of your life right now.
With his head shaved and prepped, it's time for surgery to begin. Dr. Yount is starting on the left side of John's brain and makes sure John understands everything he's doing.
Left side of his head, which will be for the right side, because that's his worst side. Typically, we start on the worst side. How you doing under there, John?
I'm doing fine.
Okay. You're not going to feel this. So it's going to be really loud for about a minute, okay? Here we go, John. It's going to be real loud.
Before any electrodes are put in, Dr. Yount asks John to draw a spiral and sign his name. He will use this as a comparison after the electrodes are put in place. This former art teacher's signature is clearly not legible. It's time for Dr. Yount to place an electrode tip into John's brain. Micro-electro recordings are made to verify the positioning.
So I'm watching the computer because that little number up there tells me how deep I am.
Dr. Yount likes what he sees and decides to put in the final electrode.
And our spot, so we're going to put our electrode in and give it a whirl.
Dr. Yount inserts the electrode, talking to John as he works deep in the brain. John is again asked to sign his name and draw a spiral. You can see a marked improvement.
Hold your right hand up for me, John.
Very steady. Can you hold your left hand up? Okay, both hands are steady.
Dr. Yount is satisfied the electrode is in the right place, so it's time to turn on the stimulation.
I think we're okay. I think this is an adequate test, and that's 0 and 1, right?
Yes.
I think this is perfect. I mean, really don't want to change it at all.
John also held a coffee cup and drew another spiral and signed his name, a signature you can finally read. Dr. Youn is pleased with the test, and now it's time to move on to the right side of John's brain.
I know on the left side that my ideal target was 2 millimeters posterolateral to my planned target, so my first pass on the right side is going to be the same. If we get good activity, we'll call that our sweet spot, and then we'll be done.
Dr. Youn got the response he was looking for. John's tremors were virtually non-existent when the stimulation was on. Unfortunately for John, the break from tremors was brief. His permanent stimulator will not be working until after a second surgery to implant a pacemaker-like device and wire to deliver electrical stimulation to areas of the brain that control movement. The true test will come in 2 weeks when John meets with his neurologist.
You've been itching some?
But first, a follow-up visit to Dr. Youn's office to get his staples removed.
His incisions are healing up well, no problems.
Well, I better go report in, I guess.
1 week later, the day that will determine whether this artist will ever paint again. Neurologist Dr. Stephen Gable will turn the stimulator on. John's getting nervous.
Done a lot of thinking about what's going to happen. A lot of hoping.
Using a handheld computer, Dr. Gable first works to find the right setting for the right side of John's brain.
I feel something.
What do you feel?
There's a little pulsating or a little like levitation.
John's left hand continues to shake, and Dr. Gable keeps making adjustments while John and his daughter anxiously wait for some sign the surgery was a success.
Ooh.
15 minutes into the appointment, John witnessed something he hadn't seen in years. His left hand wasn't shaking.
Oh, yeah.
How's that doing with your tremor?
Feels controlled.
Can you put your hand out in front of you?
Now there's relief.
With John's other hand still shaking badly, Dr. Gable tries to find a setting to calm the tremors. Over a 30-minute period, there were lots of adjustments, and you could see the concern on John's face. But Dr. Gable keeps making adjustments and finally hits the right spot.
How does that feel?
That looks really good.
Can you put your hand out in front of you? Okay, can you dance your fingers? How's that?
Better. Wow.
Yeah, that looks really good.
Does that look like something was done?
Yeah, yes. Yes. This is unbelievable. Now I'm getting excited.
15 years after his diagnosis, John is tremor-free. When he greets his daughter and granddaughter in the waiting room, they can hardly believe what they're seeing.
How about that?
Oh my goodness.
And what's the first thing John's going to do?
I'm going to be painting. Painting. I've got my paint laid out at home. I'm going to go home and smear.
And less than 24 hours later, that's where we found John, in his backyard, doing what he loves.
It's fantastic. Unbelievable. I can do what I used to do. Draw a straight line, hold a brush with a steady hand. It's remarkable.
Now that John is in control again, he's going to live one day at a time and make it a masterpiece.
Just paint. All the rest of the summer.
There is no family history. I have a grandmother who had breast cancer when she was 76, and here's a picture of her when she was younger.
Because of her grandmother's age and the fact that she was just 35, Carrie Hazelbaker wasn't concerned when a lump was found in her breast.
When I saw the nurse practitioner, she found a cyst, and she didn't think it was anything, but to be very cautious, she decided to send me for a mammogram, so it wasn't anything that I worried about.
With a 5-year-old daughter, Madeline, and 13-year-old son, Nick, Karey and her husband, Matt, weren't ready for the results of a biopsy.
When they received the results from my first surgery, they found more cancer, which put me at a stage 1. So with stage 1 cancer, I was then going to have to do chemo and radiation treatment. It was very devastating.
Karey went through chemo, then had a lumpectomy and radiation.
When you don't feel well, it's a lonely place to be. So
made a bit easier because her mother-in-law was also battling cancer at the time, and the two were able to schedule their chemo treatments together. And when Karey lost her hair, Matt shaved his head in support.
It's the most peaceful, wonderful evening.
And during that time, when Karey was feeling pretty poorly, she got a special surprise from country singer Tim McGraw when she and Matt went to one of his concerts.
He got done with one of his songs and then came over and grabbed my bald head and walked up on stage and turned around and blew me a kiss and started singing "Live Like You Are Dying."
Karey has the concert's drumsticks framed along with the tickets and decided while she planned on living, like the song, she would always live like she was dying. And that's part of the reason she made the dramatic decision, in spite of now being cancer-free, to have her breasts removed and reconstructed. Karey decided worrying for the next 40 or 50 years that the fear of her cancer would return would not be living. She says she's excited for the surgery that will also spare her nipples, but she's mostly looking for peace of mind.
I had a mammogram, an MRI, and a PET scan that did not detect the invasive cancer, the stage 1 cancer. So after I've gotten through all my treatment, I've had time to think. We've discussed a double mastectomy, and I felt for me that was the best route to go.
And her surgeon, Dr. Michael Rotkus, who had performed 20 combined mastectomies and reconstructive surgeries alongside plastic surgeon Dr. Ronald Downs, agreed with Karey's decision.
She's so young, and so we would continue surveillance throughout the next 50 years of her life. And she decided that, you know, for safety and anxiety and sleepless nights, she wanted to consider doing a mastectomy to reduce her risk of ever having a recurrence.
And by combining 2 surgeries at once, they can also preserve Karey's nipples.
Historically, we felt that we have to remove all the breast tissue, including the nipple and areola, but the feeling on that has changed, and we now feel that it's safe. We have enough experience with it to say that it's safe to preserve the nipple and areola and produce a better cosmetic outcome.
And he believes women who beat a deadly disease shouldn't have to be maimed with scars that will remind them for a lifetime.
They feel good about the way they look. They're not at all embarrassed when they get out of the shower and walk in front of the mirror.
Which Dr. Rotkus says means more to women than most could imagine.
How was your day at school?
So today, Karey is picking her kids up from school, something she hopes her surgery will guarantee for years to come. Her next stop is surgery, which she admits is a bit scary but important.
Just to reach other women, you know, if this is something that can help other women out there that are going through the same thing that I'm going through, that's important to me. I mean, God gave me this body, and I'm here to show people not to be afraid.
To live like you were dying, like tomorrow was a gift and you got eternity. Think about what you do with it.
I think it plays on every woman's mind that has had breast cancer. The worry of it returning.
And that's why 36-year-old Karey Hazelbaker, a wife and mother of 2, who is now cancer-free after having chemotherapy, a lumpectomy, and radiation 1 year ago,
last one, promise, imipramine,
is now in the hospital preparing for a double mastectomy and implant surgery, all within 3 hours.
When I had my mammogram done and my MRI, it did not show the invasive cancer portion in my body. So this is going to give me a peace of mind.
And because of her age and the location of her cancer, Karey is a good candidate for what doctors call a nipple-sparing mastectomy. For many women, mastectomy means a large cut across the breast horizontally to remove the cancer and nipple. Often expanders are put in and a second surgery is needed in a couple of months to put in implants and build a nipple. Kareys' double mastectomy and implants will be much different. 2 local doctors, who are the only in the area performing this surgery, will work as a team to remove Kareys' breasts and then immediately put in implants. Surgeon Dr. Michael Rotkus has performed roughly 20 similar operations in Michiana over the last 2 years.
We're going to remove the entirety of the breast tissue but preserve all of the skin, including the nipple.
Dr. Rotkus checks in with Karey and her husband Matt.
Ready to go.
Our primary goal is reducing your risk of ever having to deal with this again.
Right, sure, right.
Dr. Rotkus is working in tandem with plastic surgeon Dr. Ronald Downs.
Put some nice purple marks on you.
Unlike traditional mastectomy, Dr. Rotkus and Downs will make Karey's incision underneath the fold of her breast.
So what marks are you making here now, doctor?
We're marking the inframammary fold. That's the native inframammary fold. This is the connections that we don't want to change. So when we do the reconstruction, it's going to look, it'll be in the same exact location.
Love you, babe.
After a kiss from Dad and a tearful goodbye with husband Matt, Karey's wheeled off to surgery. Dr. Rotkus and Downs discuss where they'll make their initial incision. It will take roughly an hour for Dr. Rotkus to remove Karey's breast tissue and says in her case preserving the nipple is not a threat the cancer will return.
But that was kind of an anecdotal or a historical fear that's never really been proven.
After nearly an hour, Karey's breast tissue is removed.
I'm switching sides.
Time for Dr. Downs to work on reconstructing Karey's breast. Another key to the success of the surgery is a piece of equipment called SPY, which gives doctors a look at the vessels.
What this is telling me is that the nipple is going to be fine. That's showing the blood flow through the skin flap. So we have got great blood flow through our skin flap.
After trying a test implant, Dr. Downs decides which is the best fit for Karey.
See, now that's a nicer size to me.
Another advancement in this surgery is this biologic wrap placed over the implant to prevent tightening caused by previous radiation.
It incorporates and becomes part of the tissue, and it provides a covering for the implant. Then we'll really put a nice layer between the implant and her subcutaneous tissue and skin.
It's time to sew Karey up, and then some surgical super glue is put over the incision. Dr. Downs and Rotkus repeat the procedure on Karey's other breast and then wrap her lightly.
But when she wakes up, though, she has breasts, and when we take this off tomorrow, we'll put her right in a bra.
Because of her age and overall health, both doctors are pleased with the results.
Because it is very important for her to wake up feeling whole.
And best of all, she's cancer-free.
And she's cancer-free, and that's job one.
And she's going to live a long time. She's an attractive young woman, and we want her to feel good about the appearance of her breasts after treatment for breast cancer. So I think it's very important to be able to offer this option.
And for Karey, it was important to share her story with other women who may be facing the same diagnosis. Yesterday, we took you into surgery at St. Joseph Regional Medical Center, where 36-year-old Karey Hazelbaker of Goshen underwent a double mastectomy and reconstructive surgery.
And that looks real nice.
Already a breast cancer survivor who last year underwent chemo, a lumpectomy, and radiation, this young mother of 2 didn't want to take any chances. That's why she's in the operating room, where surgeon Michael Rotkus and plastic surgeon Ronald Downs were able to remove Karey's breast tissue, put in implants, and save her nipples in about 3 hours' time. Fast forward 2 weeks, and we meet up with Karey at Dr. Rotkus's office for her checkup.
So everything's going well?
Everything's going great.
Not having much pain anymore?
No, I feel good.
Dr. Rotkus examines Karey's breasts and is pleased with the outcome.
And the scarring underneath you'll never see, and the swelling will go down also, and the implants will drop a bit, so you'll have a more natural contour and slope to the breast.
And if you would have done an incision across here, would I have lost my nipple then?
Mm-hmm.
Yeah.
That's the way most surgeons feel comfortable doing it.
Dr. Rotkus says national experts agree many women don't need their nipples removed. We had Karey leave her bra on because the only scars you'll ever see are underneath her breasts.
And she's being held by her bra, so if
Yes.
she took her bra off, her breast would drop, and
Yeah.
you really wouldn't see that.
Right, exactly.
Major surgery, yes, but major peace of mind is what she's looking for as she and her husband raise 2 kids.
I think it was the fear of the cancer coming back. I knew that I never wanted to go through chemotherapy again. The cancer was hard to detect in the first place. I was very fortunate to find it the first time.
And Dr. Rotka says while this surgery isn't for all women, Kareys' cancer was away from her nipple and in the early stages.
This is good for prophylaxis, okay, for maybe somebody who doesn't have breast cancer but who has a genetic mutation that really increases their lifetime risk of breast cancer and they want to be proactive. It's an excellent approach to somebody who has smaller breasts because the ability for us to reconstruct them the way they look initially is much easier.
And because Karey no longer has breast tissue, she won't need to have any more mammograms. Karey's come a long way from her diagnosis, which she feared meant dying or living without breasts or with scars. And she's sharing her story so other women facing the same diagnosis know there is another local option.
Go for it. It's a peace of mind, and in the long run, I think you'd be much happier. I was 35 years old when I found out I had breast cancer. I'm now 36. So, God willing, I have a long life to live.
Alongside her husband, as they watch their 2 children grow up.
If you're a man and live to be 80 years old, there's an 80% chance you'll get prostate cancer. In fact, it's the most common cancer in men. How your doctor chooses to treat your cancer is determined by your age, general health, and the likelihood that the cancer will cause trouble. But since the use of robots for prostate cancer was FDA approved in 2000, a Columbia University study shows it's become the gold standard across the country.
This is the first one that I started with. This was my son's, and that started off my whole collection.
65-year-old Stan Heineck's Rolling Prairie home is a tribute to his passion.
Strip them down, take them down to bare metal, redo them, put new wheels, new paint, new decals on them, and build them like the original tractors.
Still working in sales and a LaPorte County trustee, Stan's hundreds of toy and pedal tractors have been written up in Toy Farmer magazine. Like the magazine, each piece in Stan's home tells a story.
The Oliver 88, Super 88 came from the lady was from South Bend. She was president of the Oliver Union in the mid-60s.
But Stan's story changed in October when he was told he had prostate cancer.
Like everybody, shocking. It's a shocking experience to go through.
Because caught relatively early, Stan's options were radiation, hormones, or surgery, including a minimally invasive robotic procedure. Having already lost his wife, surviving open heart surgery and bladder cancer, Stan was ready to fight his latest challenge head-on with the help of a robot called Da Vinci.
This robotic thing is a thing of the future.
We first met Stan with his 3 children in the early hours of the morning at South Bend's Memorial Hospital. Stan and urologist Dr. Carl Walker agreed to let me and photojournalist Don Schoenfeld follow his robotic surgery from start to finish.
Good morning, my name is
Good
Judy.
morning. Nice meeting you.
Step on up there.
Stan is weighed, ID'd, and prepped for surgery.
Okay, we're fine on that.
Now it's on to the holding area where he jokes around with the nurses.
Should I jump?
No, I hope not. I'm going to
okay.
numb you her first, okay?
It's now 7:30 a.m., and Stan's kids are brought back to the holding area, and Dr. Walker stops by.
Good to see you again.
Good to see you.
Yes.
All right.
Yes.
You ready?
I'm all ready. Let's go.
Doctor, you're not even going to be over me, are you?
I'm not.
It may sound like science fiction, but Dr. Walker will be performing the surgery with the help of 3D imaging.
So the patient will be on a cart, basically, with a robotic arm that, through small little ports in the abdominal wall, will be managed laparoscopically. As the surgeon is moving his fingers, it's moving the arm, the small microscopic instruments within the abdominal wall.
Stan's anesthesiologist checks in, and the nurses work to keep the mood light.
Okay, you are going to get this relaxing medicine. I want myself relaxed.
While confident, there are the usual pre-surgery jitters and time for goodbyes.
Can you feel it?
Love you.
Now relaxed and napping, it's time for surgery.
We're leaving.
Oh, okay.
You ready?
We're ready.
Okay.
It's off to the operating room. With Stan and the doctors ready, it's time for me to put on scrubs and head into surgery. It's 8:35, and even though the surgery is minimally invasive, it still takes a full surgical team. They methodically go through all the checks and balances and start the procedure.
We're just insufflating the abdomen right now with CO2. This allows us to put the trocars in.
Trocars are the pointed instruments you see going into Stan's stomach area through just 6 small incisions.
Are we ready? Ready.
The surgical team starts moving the Da Vinci robot into position. Dr. Walker takes a look inside Stan's abdomen to make sure the trocars are in the right place. A reminder, what Dr. Walker and the rest of us are seeing has been magnified 10 times. The instruments he'll be using on Stan are tiny.
Yeah, just hold that for a second, just right there, just stay.
With the robotic arm over Stan and the abdomen in place, Dr. Walker puts the tiny instruments he will use to remove Stan's prostate through the trocars.
So those small trocars that we placed, that's all the instrumentation that we'll be using to dissect the prostate and remove it.
So everything's in place now for you.
Everything's in place now to actually start the actual surgery.
And now time for this surgeon to move across the room, where with his hands, stocking feet, and a robot named after the renowned painter and scientist Da Vinci, surgery takes on a different art form.
It's like a video game, basically.
A very detailed video game, perhaps. Now, tomorrow night at 11, we'll show you exactly how this surgery is performed, what recovery is like, and we'll visit Stan to see just how he's doing a few weeks after his robo-surgery.